Welcome back to AZH Wound Center in Milwaukee, Wisconsin. I'm Dr. Jeffrey Niezgoda. We've been talking a lot about eschars, when to debride them, when not to debride them, and one of the most common causes of eschar in the geriatric population is skin tears and trauma. These patients have frail skin. They are oftentimes on medications that place them at risk for hematoma formation, and minor trauma will cause hematoma. As you'll see, this patient presented today, he had trauma to the right upper extremity and obviously developed a hematoma. The question is, how do you manage this wound? Well, if this was intact and dry, as you see on the outer surface, I'd probably be maintaining that. However, what you notice that is different in this patient is along the margins, there's separation. You can see that eschar is already starting to lift. Here you see it even more impressively, that the hematoma has been violated. The eschar is lifting, the hematoma has been violated. The problem here is that this is a portal for bacterial entrance, colonization of the underlying hematoma. As we've discussed in prior episodes of the wound care window, this medium underneath this eschar is a perfect culture medium for bacteria, and he could certainly develop a pretty significant infection. So what we want to do is we want to remove this, we want to clean it up, and perform aggressive wound care to keep this from deteriorating, developing infection, and more importantly, to foster healing. I'm going to stay in the plane between the eschar and the underlying healthy dermis, so hopefully we're not going to have a lot of pain. If this does hurt you, you tell me, okay? I don't think you're going to feel a lot of this. So really, I'm breathing right through the hematoma. We'll go ahead and develop some of these margins as we move along here, but this tissue is gelatinous. If you look under here, this is all old hematoma. And we can develop the plane between the hematoma and the eschar by just coming along the margins and just taking that tissue. You can see I'm taking my blades, you can see them underneath, and then I'm going to dissect that tissue, and then we're going to come and develop dissection through the hematoma, just sort of lifting it off its base. What I'll do is I'll come back and I will clean the rest of the hematoma off once we get the eschar removed. And this tissue is not sensate because the tissue is dead. So it can be accomplished fairly painlessly. Again, we're taking that grape jelly type tissue off. It's about lunchtime here, so kind of making me hungry for a peanut butter and jelly sandwich. Just kidding. And we remove the hematoma. As you'll see, very tough and leathery on the outside. Again, this is the medium that bacteria love and no longer is available to them. Get rid of that. Now, we should be able to evacuate the rest of this hematoma using some mechanical technique, gentle mechanical technique. This dead blood will draw off the surface fairly readily. You may not be able to accomplish all of the debridement of the underlying hematoma during the first try because of pain, but we try to do as much as we possibly can. The important thing now is that this can be cleaned serially during dressing changes and decrease the risk of infection. Sometimes a little bit of a sharp technique can be helpful. or blunt technique. But again, the important thing is to get as much as you can without hurting the patient, and then allow the rest of it to separate over time. So we will start aggressive wound care, as well as routine and frequent cleansing of this wound base, which should provide us with a decent result. And if you look through the areas of hematoma that we can see here, this tissue is fairly healthy. As you'll see here, patients should do well with our wound care regimen. Hope you've enjoyed this edition of the Wound Care Window.